Hi, good morning, everyone. This is 1 month after my L5S1 discectomy. So I am actually slowly getting back to normal. And as per my pain, I have a mixed of some days I get pain, tingling, and the nerves is still affected. But other days I am actually okay. The wound is healed up pretty good, and I'm glad that the infection I took antibiotics and it is healing now. Main thing which is on 1 month mark, what I think about is as per the surgery thing, is it's been a mix of everything. While some days you feel really good, some days you feel really bad because of the pain. There's a lot of things are affected by it. So I would say that you have to expect at least some ups and downs in that journey of recovery. So if that is expected, you won't feel worried or anxious about it. So a couple of days I had severe pain lying down and everything. There was slight a bit of inflammation, and I've been walking every day, actually at least 5 to 10 minutes. Yesterday I tried to walk. The weather was nice, so I could walk a little bit better. So I have to get used to that my normal mode. As far as the nerve tingling and the sensation and the pain, which I'm feeling discomfort in the legs and the thighs, you can still feel it because your nerve was compressed for almost 1 year after the accident. So what happened is the longer the nerve is being pinched, the longer it gets to get back to normal. So I definitely expect that it is definitely is something which is related to the nerve. The nerve is not sensing that it is still not in the recovery mode. So that's another thing. So I am actually hope more positive, but some one of my doctor primary care told to take some gabapentin, and I take diclofenac at least once a day so that I don't feel much pain when I'm sleeping and I can get a good night's sleep. So I have an option to take gabapentin 100 milligram if I have to. So I will try to take gabapentin and see whether it helps me in the nerve tingling and nerve desensitization. So which is an optional thing. So I have the surgeon's appointment on February 22nd. On that day, which I will get to know that whether I am able to go back to work after 6 weeks, and what can I do, what I cannot do, when can I start physical therapy, and what's physical therapy exercises I can do, all these things. So pretty much speaking, it's a process which is long, but we have to be patient with everything, especially with the recovery. I had a rough days in couple of days, in third week and fourth week, where I got the infection, and the infection I had to go to the surgeon's clinic to check it out. So always remember, for those who are going through this process, do not jump and start doing things. Take it slow. I'll summarize it in week by week. The first week was okay for me. First 1 or 2 days was a little bit difficult, then it was the wound which is healing. Second week was a little bit rough. I got the infection, and then I had pain. I had severe, I was anxious, very anxious about it. Then they found out it was MRSA. So they had to give me another antibiotic for that one. So the third week was that, and then I definitely, and fourth week onwards, I'm feeling my nerve is trying to be sensitive. That area is still like kind of a fresh wound, so the nerve starts tingling, and nerve is like kind of, yeah, I can feel it in my calf and thighs when I walk and exert and all those things. So things like this is very normal and very expected to be in this process. But my suggestion is using a pillow in between your legs, using an M rail, using toilet seats, raised toilet seat will help. Now I don't need that. It's just first 2 weeks you need all those things, but sleeping on the side is still difficult because the sleeping on the side gives you, like, I think the nerve stretches it. So that is what I can't do, any nerve glide or anything like that. The nerve glide make you feel that the nerve is tingling, so I don't do that. So I'm not doing any exercise except walking. So I can walk maybe like 1 mile now. So I'm just walking back and forth and coming back. I'm doing some cooking in the kitchen, and just moving around, that is all, mainly, and doing some reading and activities. So make sure that you are busy, doing things that, because for me, I was a very busy person, doing work and so many other activities. So keep yourself busy, because that can make you really like depressed. And especially weather matters too. Nowadays it is winter, and some days the weather is so down and you don't feel like getting up from the bed, and you feel so tired, and you have no motivation to go ahead for the day. So for me, I have found certain things which I love to do, and certain things I love to read, and so my days are planned ahead like that, so I don't feel much kind of a problem. But I know, when I was really worried about my tingling sensation and the pain running down I was anxious. I was thinking like, oh, did I do right thing to do the surgery? So there's questions always in your mind, no matter what or where and what, how good you are or things like that, you will still feel that kind of questions. So those kind of questions always arise, and you can find answers. So that's why this video is also for people who think about those kind of things. Please listen to some of the videos. There's great recovery videos in YouTube too, so I definitely will tell, like, listen to some of the videos. That's why I also thought of creating one of this recovery video. As far as movement is concerned, you should not bend, you should not lift, you should not. So I'm not doing that, but you can do like squat down. If you're strengthen your core, you can squat down and do things like that, or otherwise use a picker to pick up things if you accidentally have to do it. Otherwise, get help. Regarding the pain wise, I would say the pain is at 4 and 5. Some days it's at 3 and 4. Right now at this fourth week or 30-day mark, I can handle the pain. And some days, I definitely have to take an anti-inflammatory, because there's a lot of inflammation in that area. The area where the wound is, you can still feel that there's some days it's like kind of a thick feeling, because it's like inside the bone is still healing. So I would definitely say taking an anti-inflammatory is an optional thing. Yeah, taking a gabapentin or any other nerve medication, if your doctor agrees with it, please connect with your doctor and see whether he agrees with it. So that is one another option, I would say. So apart from all these things, my positive point here is I am able to walk better. I was totally limping, and my foot, I was like literally dragging. Now I am able to walk better, though it is a little bit stretch. That is a positive point. So whenever I walk, I always compared it with what I was feeling before, because whenever I walked, I had a limping. So that is the positive thing about, which kept me like not worry about it. That means I'm in the right direction, and I'm healing well too. And plus, rest all things, I had emailed doctors and physical therapists, and they all said that that's very common. You should expect all those things. The full recovery will come. Take it slow and all those things. So I'm planning to see the doctor on February 22nd, and I will update you guys after that. But if there's any questions in between, please reach us. You can directly in the post, or you can email me bgpaul@me.com, and I can answer some of your questions, what I went through and why I went through all these procedures, because I had an accident in last year in July, and then it led to series of things, and the pain was not going away, and MRI was delayed for a year. And finally, when I went to India and got an MRI, I realized that there was an extrusion. And then I got some massage therapy and treatments there, but nothing helped. When I traveled back, it all effectively, like, my numbness came severely bad. Half of my butt was numb. In October first week, I literally got my foot drop. My leg was totally numb and cold, and I couldn't walk. It was miserable pain for first 2 weeks, and then I took steroid injection. Then it all subsided a little bit, but still residual effects. So it was very bad. I couldn't walk properly. I couldn't squat. I couldn't sit in the toilet seat. I went for all kind of therapies. I had massage therapy, physical therapy. I had traction done. I had chiropractor adjustments every week before all these. And I had late after this happened, I went to pool therapy too. So pool therapy helped a little bit in strengthening my core. That was a very plus point before the surgery, that I had strengthened my core. So to summarize, this was the events which happened before the surgery. And when I got the call for the surgery, I had to choose in a day or like in half an hour whether I should go for surgery or not, because I already had seen the surgeon before, but I okayed it, but I was very doubtful whether I should go for the surgery. But somehow I pros and cons, I weighed it in and talked to medical professionals and friends and family members. Finally decided that it is better to go for surgery. And overall, I'm eating healthy. I'm not, I'm exercising or I'm walking. I'm trying to not to gain any weight or balancing my weight problems too. My sugar is under control. It runs at 105 to 120, not more than that. I eat very low carb diet. So this all helped, and no smoking, no drinking, because smoking and drinking is very bad when you have a healing process going on. So absolutely no smoking. This will reduce your healing to 50%. So you always have to be aware of that. So apart from this, that is all for day 30th. Hopefully I will be coming back after the doctor's appointment, and I'll give you an update on what is happening. And thank you everyone for listening to me, and all who have supported me in and through, for bringing food, my family members, my friends, my church members, everybody who gave me a lot of support, praying, as well as my parents and my siblings and everybody. So thank you all. Have a nice day.